Spencer Hutchins got his startup experience right out of Colby College with a senior role in John Kerry's presidential campaign. From there, he took on a series of government and policy roles before co-founding Reflexion, a rehab software company. And then in 2016, he founded Concert Health, which helps independent physician practices deliver integrated behavioral health services. In essence, it's a group practice that leverages collaborative care management reimbursement from Medicare, commercial insurers, and now Medicaid to do the right thing for patients. I'm impressed with how Spencer overcame dyslexia and dysgraphia to reach his potential as an entrepreneur and leader. I'm your host, David Williams, president of strategy consulting firm HealthBiz Group. Enjoy the show, and if you like what you hear, make sure to subscribe. Great. Well, Spencer Hutchins, founder and CEO of Concert Health, welcome to the HealthBiz podcast.
Thanks for having me. It's a pleasure.
So you're out in sunny San Diego, which I'm jealous, but I could stay inside and I don't have to wear my hat. I guess when I go out is the only benefit.
Yeah, more sunscreen budget here for sure.
Exactly. Good. Well, we're going to talk about what you're up to now, but you've had a very interesting path to get there. So maybe just start off a little bit with your upbringing. You know, where did you grow up, and any childhood influences that stick with you today?
Sure. I grew up in Lexington, Massachusetts, 15 miles or so outside of Boston. Always a precocious kid. I guess my biggest influence early on was a diagnosis of dyslexia and dysgraphia. So I had a lot of trouble early in school. Most important person in my life to fix that was my mom, who figured that out and wouldn't take no for an answer, and figuring out that I was smarter than people were realizing. And so got me a lot of help and individual education plan and all that kind of stuff, which by the end of high school was really starting to click in exciting ways and realized that I could be good at school. Went from there to Colby College up in Maine, a small school. Studied economics and government, and had a blast doing both. I think I always was fascinated with public spirited things, politics, public policy, but also power of capitalism and free markets and organizations to make a difference. And so you saw that early in the classes I liked, and also the majors I started to have there, and probably shaped then how I thought about the rest of my career unfolding.
That's pretty good. You know, Lexington, Mass is a good place. You know, not only is it sort of from where the shot heard around the world was fired, although I'm from neighboring Concord, where I was taught when I was little that that's where the revolution started. But in any case, it was somewhere between Concord and Lexington. And it's also, I think, a blessing if you have, what they would have called in those days learning disability or whatever, to know about it and have it diagnosed, because it's a heck of a lot better than an undiagnosed version of that. So kudos to your mother in case she needs any more.
Yeah, I'll make sure she listens to the podcast. Yeah, the one thing that both Lexington and Concord kids can agree on is a shock that Patriots Day in mid-April is not nearly as big of a deal in the rest of the country as we're led to believe.
What the
growing up, like you leave Massachusetts and you're like, wait a second, no one gets this day off. It's mid-April. Like I haven't gone to school on this day, in my whole life. So we'll have to keep working on that.
That's a culture shock, but So now you spent a little time down in New Haven at Yale. What was that about?
Yeah, so, right out of college, I tried to get John Kerry elected president. That almost worked. Worked well for me because I met my wife.
Nice.
And so had a blast for 2 years. Left there, started a senior intern. I got paid, I think, $800 a month and lived with my parents in New Hampshire, and where they'd relocated, and ended up managing a team of about 200 people, 3,000 volunteers on election day in Tampa, Florida, and just felt like I had this unbelievable set of raw management skills, certainly no training. Didn't want my entire career to just be in political campaigns, but didn't know how I'd go get a job in the real world by itself. And so business school was a good way to go to sort of round out some learning I wanted to do, as well as maybe create a stamp of approval on some of these really great leadership skills I thought I'd built in a way that companies could, get their heads around more clearly than trying to go directly to the job market. So had an amazing 2 years at the Yale School of Management, got my MBA there, which at the time was on the young side, although I think those schools have started to often get people younger in their careers than they did back when it was 15 years ago that I did that.
That's great. talking about the Kerry campaign, one of the underappreciated elements of a political campaign, or in fact a job in government, is you can end up with really senior level of responsibility, quite early on. So you may have been only getting paid $800 a month, but the level of kind of authority and the way to
Yeah.
sort of jump ahead in your career with that, I think, is really amazing.
Yeah, I mean, I think a lot about presidential campaigns are particularly kooky. It essentially is an organization that doesn't exist other than, a small circle of longtime friends and advisors. And then in a single job interview in a 2-year window, you go from a couple dozen campaign staffers in New Hampshire and Iowa to, at that rate, the budgets have gone up even much farther, but we were spending in the final few months of the campaign like $1 billion a year
Yeah,
run rate, right?
right.
80 to $100 million a month. And you're probably activating a couple million people, right? If not a little bit better than that, maybe 10 million people that are going to do more than just vote, bumper sticker, knock on door, or something like that. And so if you think about startup promotion cycles or startup growth cycles being fast, there almost none of them touch anything close to what
Yeah.
political campaigns do.
That's amazing. So you had sort of a succession of kind of political, government, policy roles early on before going, more full fledged into your entrepreneurial role with business. What was that
Yeah.
kind of pathway like?
Yeah, so I did what most people do coming out of business school and they don't know what they want to be when they grow up. Was I went and became a management consultant.
Yeah,
Felt like a good way for me to continue to learn and be the first time I'd really worked in the private sector. So I had a great run. I joined a small firm called Katzenbach Partners, which was a spin out of some folks from McKinsey that had left to start their own firm, and was there through an acquisition at Booz and Company. So I spent most of my time at the small firm and then some at Booz and Company, and fortunate to be able to take a couple of breaks from that and go back into scratch the public service, public sector itch. So I got a chance to spend a year and a half or so in the first term of the Obama administration, helping start a healthcare team at the Federal Communications Commission. So I think that was one theme of always looking as a way to mix public and private, or public spiritedness with the private sector, and the innovation that can come and effectiveness that can come. And also in my consulting career, just I could pretend I had a strategy. It's really just the cases I got assigned to, the partners I ended up liking and working with. About half my life had been in technology companies. About half my life had been working for healthcare payers and providers, and on the consulting side. And that FCC experience was an opportunity to combine them and actually start working on kind of technology, healthcare strategy inside of technology, or vice versa.
Sometimes it looks very strategic and organized in retrospect. And one of the things for people to realize, in their career is that you look what every people have done, and it's not as though they necessarily had this, specific plan all laid out. But if you have an idea of what you're looking for, you follow good people, you do what you're good at and
Yeah.
what you like and what makes sense, you can get there.
My family's a big fan of Frozen 2. That's the age of my kids right now. And, my wife and I joke a lot about how good Anna's advice is, that just do the right next thing,
Yeah.
right? So both act ethically, have the right values, and then be opportunistic for sure. Because this was not an intentional path to go from, political campaigns in Colby to starting behavioral health organizations 15 years later, but found me that way.
Sounds good. So Colby's all the way, if we look simplistically at the map, sort of all the way in the upper right, and San Diego's kind of all the way down in the lower left. And you seem to be there
Yeah.
for well, for other things before that, but also for Reflection, which you had started. And you pronounce it Reflection or Reflexion, or how it was?
Reflection.
Yeah.
Yeah. Reflection. Yeah.
So what was that about?
Yeah, so after the time of the Obama administration and consulting, I knew I didn't want to be in the advice giving business the rest of my career, and I got a chance to get a maybe not a front row, but a front section seat to the passage of the Affordable Care Act, and it felt like there was just a huge amount of opportunity and change that was coming. Frankly, I think legacy. There's been a lot of fairly successful businesses built in healthcare that were cynical, right? We're about kind of,
Yeah.
extracting value, right? Making money and figuring things out. And it felt like the Affordable Care Act was going to push us in a place in which actually the business of healthcare would be a little more aligned with where we wanted to be, which is focus on healthy living and lower costs and more efficiency, better lives. And it didn't really want to be in the business of helping the biggest organizations in the country not get disrupted. But those were the ones that could afford my consulting firms. And so found my way out with an opportunity. A boss and friend of mine at the FCC had a venture capital background. He got recruited to run a family office called West Health in San Diego. And so I had the opportunity to come join him, learn a little bit what it was to make Series A and Series B investments in the venture capital space, and then work for the affiliated medical research organization that was prototyping ideas and technology that could lower the cost of healthcare in America. While I was there, met a really amazing physician, Ravi Kumadureddy, and we came up with an idea which started as a project inside of West Health, and then we spun out as an independent organization called Reflexion Health.
Great.
What we were doing there was we were 90% right, 95% right about a lot of assumptions, and it was that we needed to change the way musculoskeletal care was done. We started with a software product that could help people prepare and recover from knee and hip replacement surgery using the camera that Microsoft popularized with their Kinect platform for video games.
Yeah.
So it was a way to essentially play a physical therapy video game so that you could sort of do your prehab and rehab and then have a device in the home that could be your communication hub with your surgeon and your physical therapist. And then we ended up selling it to orthopedic groups that were moving into bundle payments for those. So they were looking for a way to both differentiate the patient experience, get great outcomes, as well as save on rehab costs. Now that they're moving into a different construct of the way they thought about knee or a hip replacement being an entire episode of care with a single revenue stream versus divided up by each time you did service on the patient.
Great. Well, that sounds pretty useful. Spencer, it sounded more and more like you did have this master plan, and I just I want to take what I said before. It sounds so well organized. I'm almost believing it. So,
yeah.
But so now Concert Health. So that's about 2016, and as I understand it, the company's focused on integrating behavioral health with sort of typical physical health practices, maybe primary care and others.
Yeah.
Why is behavioral health such an important issue to integrate with the rest of care in the first place? Why does it matter so much?
Well, we made a really bad decision over the last couple hundred years, which is deprioritizing the brain versus the rest of the rest of our body, and also thinking about behavioral health or mental health as something that's somehow totally separate from the rest of medicine. If you talk to anybody, we all know people that have had depression, anxiety, or other behavioral health symptoms. We all know those things interact with our weight, our diabetes, or other aspects of life. And any primary care doctor has always known they've been at the front line. And so how often those things are intermingled. And for something like 20 years, there's been a growing set of evidence that really managing those conditions together can be much more effective for a few reasons. The first is around willingness to engage, right? There has been resistance to the concept of having depression or naming it or anxiety prior to, but a lot of times people have really strong relationships with their primary care doctor, so that's a place in which people can accept care. And then also, without realizing it, we've really turned primary care doctors into the de facto mental health care system, particularly in rural areas, but really everywhere in the country. They write far more antidepressant prescriptions, as an example, than psychiatrists do, because there simply are not nearly enough psychiatrists to manage everybody with these conditions. Our best guess is 15 to 20% of us in any given year, maybe a little bit more during the pandemic, have a diagnosable mental health condition. And primary care are the only people that have the capacity to both know us, we have the trust, and the just ability to see and manage those patients. And so there's been a growing body of evidence that empowering primary care to do better in that case is the fastest way to get everyone the access that they need. And it wasn't happening fast enough, so we decided to start Concert Health as a way to try to accelerate that.
It makes good sense. I remember it was probably at least about 10 years ago, I'd seen some research that indicated that somewhere near, and don't quote me, but it's somewhere near a half of visits to primary care were kind of mental health visits, even if not described as such. So somebody come in with a stomach ache or headache or, insomnia or something like that. And, it might be addressed directly at that issue, but it turns out there was, underlying issue. And that's, I think, why some of these depression screening surveys occur when you go to primary care and so on. So It's good to hear that you've actually been able to make some progress in the past. Now, what's happened? So it's been realized, I guess, for a while, and now you have company that can do something about it. What do you do, and what are some of the things in the environment that enable you to be successful?
Yeah, so Concert is building a high-performing group practice. So we employ about 240 behavioral health clinicians. We care for patients across 13 states, and just started caring for our 28,000th patient a few days ago. And so what we do is operate around really focusing on a clinical model called collaborative care, which is a particular protocol that's been shown to be most effective in integrating behavioral health services into the primary care setting. So our principal clinician that's patient facing, we call a behavioral care manager. Those are master's trained, licensed behavioral health professionals. And they partner closely with the primary care office, often physically distributed. They're often doing video or phone visits with patients, but paired tightly with a small group of primary care doctors. And so when they identify those depressions, those patients that are having that, instead of saying, so if you think about, I'll explain it through the lens of a patient. If I come into primary care, there's probably a 50-50 chance I bring it up, depression or anxiety, because
Yeah.
I don't even realize it in myself, or I'm hiding. That's what you mentioned, those tools, like a personal health questionnaire 9, where more and more of us are answering. Those are important because they can help answer at the symptom level and give a little screening indication to the doctor of, hey, is this something I need to add to the problem list and talk to Spencer about? Even if I then bring it up with my doctor, I probably do it 8 minutes into my 7-minute visit.
Yeah.
And I try to tell my doctor a 20-minute story. And she's left at a pretty unsatisfactory moment, which is either I need to tick off my next 4 patients and listen to you for a while, even though I don't really know what to do. I might not be trained in counseling. I don't know. Or what most commonly they do, shove a prescription in my hand, say, hey, I
Yeah.
think you should take Lexapro. You should also think about seeing a therapist. Talk to my referral coordinator, or call the back of your insurance card to help you find something. Come back in a few weeks. Let me know how this medication is making you feel. They run out. I'm unlikely to fill the med. I probably don't even bother trying to find a therapist. If I try, I can't find one that takes my insurance. And, they think about me at the end of the night wondering, did I do good care there? Right. I'm trying to keep up with everybody, but what's happening? Collaborative care, and if they work with Concert, gives them a new alternative, which is them to say, hey, Spencer, I work really closely with a colleague named Verna. I'd love for her to call you in the next day or so. Verna helps me care for lots of patients going through just what you are, and she keeps tabs on how you're doing, just like we would your weight or your blood pressure, your sugars, by giving you that same tool that we gave you this morning, just to see how your symptoms are doing. Checking in on how you're doing, and she's got some coping strategies that she teaches a lot of patients they find helpful. If someone recognizes depression in themselves and is asking for it, they can say, hey, Verna's my in-house counselor, or Verna works for a behavioral health group called Concert Health that we work closely with. Or if that's language that will turn them off, they can say, hey, Verna just helps me with patients that are struggling sleeping or eating,
Yeah.
right? Mood, weight, right? Things that that's where we all live in the world of symptoms, not diagnoses on a
Right.
day-to-day basis. Anchor there, and then just do just that. Each of our Vernas, each of our care managers calls patients, video visits with them, whatever they prefer, talking over the course of that month, 2 to 5 times a month, always anchored around measuring symptoms and doing evidence-based psychotherapy interventions. Can range from things like cognitive behavioral therapy to much lighter touch things like behavioral activation or motivational interviewing. And then each of our Vernas spends an hour a week or so consulting with one of our psychiatric providers using a registry of patients, which is just a database that tracks symptom severity, trends, and interventions to figure out, okay, who's not getting better or who has particularly bad symptoms. And the psychiatric providers are not there to take over care from PCPs, but are there to make recommendations directly in the medical record. So, hey, Spencer top taking his Lexapro because of erectile dysfunction. Try this med. It's maybe, try Wellbutrin instead of Lexapro, maybe less likely to collect that side effect. And we know that he's going to need both psychotherapy and medication in order to be subclinical on his PHQ. And so that's really, it's sort of surrounding that primary care provider with the team that can keep track of patients, that can intervene and can share that expertise. So the PCP feels much more supported in just keeping track of what's happening with me, how do I do it, as well as more supported in making those medical decisions around diagnosis, medication dosage, things like that.
Going back to our theme of good strategy and planning, there's a couple things that seem to be very well aligned with the timing of what you're doing now. One that you probably would have known about, maybe planned in here, is that it's not just this concept of collaborative care. There's actually, a Medicare program around it to support that so that,
Yep.
so that you can actually have a revenue stream. But also, I would say, one of the challenges I've seen where you've got any kind of collaboration between a physician group and then an outside party, it's hard to really make it that seamless. And
Yep.
part of it is just sort of the physical element of it. And with the pandemic and more of care being remote, it seems like it all of a sudden, conceptually, it's easier to consider how you're doing collaboration even without necessarily being, co-located. So I don't know how those two things come together, the reimbursement side and then people being used to the more of a remote care, even just from their primary care doctor.
Yeah, you're right. So, the reason we started Concert, was I got exposed to the research base around collaborative care in the summer and fall of 2016, and was just fascinated by how much darn sense it made, right? Real engineering mindset to testing and learning, which is such a perfect model for a group, conditions like depression, which have many evidence-based treatments, but all of them imperfect, right? And so you just need to try, see if it works. If not, try something else. And it made sense. Not only did it make sense, though, close to 80 randomized control studies that showed that it worked. And I got fascinated by it and just said, why don't my family and friends get this? Why haven't I gotten this care? Why hasn't this spread? And there's classic reasons in healthcare, two reasons. The money didn't work, and it's complicated, right? The reason we ended up starting Concert the way we did was that Medicare announced they were going to create a reimbursement schema. And that said, my gosh, if that works, maybe this can get out of research, get out of grant funded world and operationalize. But to do it, primary care doctors around the country were going to have to learn about the model, hire a workforce, figure out a new, it's like they would love the idea, but it would take 40 years and most of them would mess it up. And that's when we started to realize that, hey, what if someone built a high performing group practice that could be the easy button, right? And make the easy part, and make that work. And that was one, what got me to my co-founder, Verna Little, who's our chief clinical officer, and as I got fascinated by it, I just started asking everybody I met, who is the best clinical operator in the country that's really done and operationalized this. And for some reason, she picked up a random phone call from me,
Yeah.
and that started a conversation in which she saw the same thing and resulted in her becoming an advisor and then coming on full time as we got going, which was incredibly fortunate because she had built this in her own group where she had been the head of behavioral health for one of the largest federally qualified health clinics in New York. And so she'd done this with a 300 or so person team across 30 clinic locations all across downstate New York. And had spent a decade consulting and advising with plans and systems across the country on how to implement this. And so she knew a lot on how to do it. And what we had to figure out was how to systematize it and get ready to scale it to meet the needs. Fortunately, on the revenue side, while Medicare was the first health plan to cover it, the commercial health plans followed. And so at this point, just about every commercial health plan in the country includes collaborative care in their fee schedule. They'll pay primary care doctors to do it. Texas and knock on wood, Connecticut, the governor is about to sign a bill there that will make them the 20th and 21st state to cover it as a Medicaid benefit as well. And so there's really, really fast adoption for this across the health plan ecosystem. And hopefully Concert is a vehicle for groups to say, hey, we love this, but we'd love to do it as a partnership as opposed to trying to figure it out ourselves.
So we talked a fair amount about the kind of demand side in terms of the number of patients that need help, and as you said, it's gone up during the pandemic. It also seems to be going up, perhaps among the younger generations, at least as sort of self-reported. And then you've got the primary care being willing to bring it in. You've got a reimbursement model. Let's talk a little bit about the supply side, because as you had mentioned, if someone gives you a list of therapists to try or say call the back of your card, that's like, if you didn't have stress and anxiety before, you will once you try to line somebody up. Now you're running a group practice where presumably you got to bring a lot of people in, and it's the same sort of supply. Why do they want to work for you?
Well, I think it's a great question and something we focus on and think about every day. I'd say historically, there's been an opportunity. There's this small group that want to do private practice, but that requires them to, or it's not that small. A lot of people do that, but requires them to run their own business. It also normally, as a result, because sort of getting paid by insurance and other things is so complicated, many don't take it, which means they end up caring for people that have the means and the willingness to pay cash for services. That can be great, but a lot of people don't want or can't do that model. And they've been able to work in the bowels of a healthcare system or a community mental health center that's often overwhelmed, overtaxed, and stretched. I think there's also now, fortunately, a lot of startups, right? A lot of startup organizations that are trying to employ. My view is that too many of them treat clinicians as part of their product as
Yeah.
opposed to the core of their organization. I think a lot of people are trying to build platforms, right, around, which is a fancy way to say have software margins, right?
Yeah.
And 1099 folks and sort of connect. And when we looked at, I think some of those are doing great work, and they really can allow for folks that want to be private practice therapists to make it easier for them to take insurance or have better technology tools. But we thought collaborative care in itself was a really powerful protocol, really powerful model, but you needed to get people to buy into it, and you needed to really manage to it as opposed to have a bunch of independent folks that were doing whatever therapy they wanted. And that really implied that we should be a group practice, right? And hire folks, train them in the model. And so why do they want to come? First, collaborative care is exciting to many clinicians. It's seen as the future of their field. It's incredibly frustrating for a therapist to realize that if someone doesn't get the dosage right on the antidepressant,
Yeah.
it's not going to do it. Or if no one realizes what's happening with the diabetes and obesity, it's going to be really hard to unlock their depression. And this gives them really direct access to the primary care provider, as well as a weekly interaction with a psychiatric provider. Each of those clinicians love that because, like, hey, this is the team I've always wanted to work with, right? This is the team that can really pull a lot of levers for this patient. And I feel like I can make a better difference. And so that happens with collaborative care generally. Then the way that we try to implement it is hopefully a way that really focuses on training and continuing development, right? Not making it an easy job for our clinicians, but hopefully making it a hard job in the right way, which is how do I learn new modalities? How do I get better at helping more patients? And then Concert's all an organization built around serving those clinicians. And so how do we build technology that makes their life easy? How do we take as much of the BS of the US healthcare system and the documentation and the admin and the billing logistics, and how can we get better and better at that? We still have way too much administrative burden on our clinicians today, but hopefully they at least feel the aspiration and they see the investment that we're making in our technology platforms, our management structure, our trainings and all that to sort of say, okay, how do we focus as much as your life as moving? When we started Concert Health, the act of employing people remotely, letting them work from home was a little more novel than it is now. And so that was certainly unique then. It's less unique now. And so I think it's really about how do we create that culture of continuous learning, a rigor around a care model, and then really attract the clinicians that want to be held to a high standard and want to be trained up to that, right? Want that support around them to do exceptional work.
Spencer, you've made a lot of progress with Concert Health, but it's still a young organization. Where do you see taking it over the next few years?
Yeah, I mean, we now are serving a group of partners. It's just, pinch me, the organizations we get to work with. So, we just announced a Series B fundraising. We're incredibly proud that two of our larger clinical and commercial partners became investors, Advent Health and Common Spirit Health, two of the largest nonprofit health systems in the country that employ hundreds or thousands of primary care providers, and they have a opportunity, or every day they've earned the right to care for more than 1 million people each, right? On any given day that are crossing their threshold and have really said, listen, this is core to what they want to do, right? This kind of integrated behavioral health, and they've asked us to help with them. And so a huge part of that is learning to first anchor in quality and excellence. How do we invest in our sort of quality team, our data analytics, our risk scoring, our training teams, so that we ensure as we scale past our 28,000 patient cared for, that it starts first and foremost with doing exceptional work and then learning from mistakes and getting iteratively better, and then really building the systems and tools and team to scale to meet the needs of those groups that we have now, and as well as new ones coming on board, because the need is at times feels insatiable. Right. But it's so rewarding when you have an opportunity, most importantly, to impact patients that are struggling, people that are struggling. There are neighbors, there are friends that are all around the country. Almost as rewarding as the patient care is really feeling like you're helping that primary care doctor, that pediatrician, that OBGYN practice the way they want to, right, with a team that's around them and gives them more confidence in the work they're doing.
So, Spencer, for the last question, I'm going to turn back toward the personal side and ask you if you have time to read any books and if there's anything you would recommend or anything you recommend we avoid.
What am I reading right now? One of my mentors back at Yale, Barry Nailbuff, just wrote a book on negotiation, Split the Pie,
Yeah.
which I'm about halfway through right now, and I am loving. Although my wife does a good job trying to make sure I keep. I don't just read all those books and reading more fiction and things like
Yeah.
that. Now I've been reviewing, making sure to review with my kids who are just learning how to read. And so we're going through The Hobbit and some of the Lord of the Rings books, remembering books from my childhood. So a little bit, some of those business books can be handy. And Barry's, I think, tips on negotiation are great. But get out of the world and enjoy some time hugging my children and reading to them is probably the best time spent
Nice.
reading these days.
Nice. Well, that's good. Well, I have such good weather. You can always go outside. In Boston or Lexington, we gotta stay inside in the in the library. So
Yeah,
that's how it goes.
you can read books out at parks and beaches too, though. So try to do that.
So I've heard. Yeah. Well, Spencer Hutchins, founder and CEO of Concert Health, I want to say thank you very much for joining me today on the HealthBiz podcast.
Thank you very much for having me. I enjoyed it.
You've been listening to the HealthBiz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.